All right, everybody, let's get started. Thanks for jumping on the webinar today. We're excited you're here. Today's title is Eminent Medical Center, Shaping a Culture for Superior Patient Experiences. And our special guest speaker, expert extraordinaire, is Jean Chirico, Chief Nursing Officer of Eminent Medical Center. Jean, welcome. Thank you for doing this today. We really appreciate it.
Thanks for having me.
Can you give us a little bit about yourself, a little background, and then also a little bit about Eminent Medical Center before we jump in?
Sure. So Eminent Medical Center is a surgical hospital here in the Dallas-Fort Worth area. We're actually located in Richardson. We're pretty small, but we're kind of mighty. We have 3 operating rooms. We have 5 inpatient beds. We have 2 observation bays. And we do a number of outpatient procedures, some bigger cases for such a small facility. People are not expecting us to have the footprint that we have, but it's very good. A little bit about myself. I have a lot of history in acute care. Past 4 years, I've been more in the surgical care environment, but I have a lot of history in ICU, critical care, ER, cath lab, inpatient. I've been anywhere from a charge nurse and worked myself up to supervisor, house supervisor, director, director of clinical operations. And then for the past 2 years, I've been here as the chief nursing officer at Eminent Medical Center.
Awesome. So you've got an extensive background, and that's awesome. So the thing I think we're excited about today, and the sort of focus as we talked before the webinar, is shaping a culture for superior patient experiences, which is really, really important. So we're going to talk a little bit about that in context of the nurse labor market, building a great culture internally, retention strategies, nurse satisfaction, and then we'll also talk about how Incredible Health can help. And this is an interactive discussion, so we do encourage you to ask questions. Go to the chat area or the Q&A area, and we'd love to address those. So first of all, let's talk about the overall market dynamics. As you can see, right, obviously, healthcare, the demand for healthcare is increasing. The number of people that work in healthcare is a stretched workforce. We're seeing shortages there in multiple areas. We're most familiar with the nursing area, of course, but it's a national problem that is getting worse. So, 1 million nurses short by 2030 in the US. There's almost a 23% annual acute care nurse turnover. And then the thing that I think is crazy, and this number moves around a little bit, but is the 95 days number on the right. So the average time to hire a permanent specialized nurse is 95 days. Do you guys see that, by the way, Jean? I know this isn't one of the questions we talked about, but what do you guys see? Does that seem high to you? Does that surprise you, or is that in line with what you guys see?
No, depending on some of our specialized positions, especially like our operating room nurses, and even before I was in the surgical realm, the critical care nurses, those specialized nurses are hard to come by. It's almost like finding a magic unicorn. That's what we call it, in a needle in a haystack. So pretty accurate.
A magic unicorn in a haystack, which is even tougher. Awesome. And then we've done some research that I thought would just be interesting to share. So like the top reasons that nurses say they leave jobs, advancing their careers, they want a more flexible schedule, commute time, and then higher compensation, which I also think is really interesting. And then their main concerns, they're just as worried about staff shortages as management is. That's the number one thing that they said was their principal concern, and I think is a really, really, really important thing. So I just wanted to set the scene there. Any stats on that surprise you, Jean, or anything that you're looking at and think, oh, that's interesting from this group of data here?
No, I would say that's pretty much, I'm not shocked by any of those things. I think that is one reason why people are looking at not staying with the same hospital systems or the same jobs in general.
Yeah, great point, right? People are moving from hospital to hospital, and additionally that, a lot are getting out of nursing altogether for some of these same reasons. So great point. Okay. I'll share this slide with you, and then we'll dive into some of the discussion with Jean. So what does Incredible Health do? Hospitals use our custom matching technology to hire quality permanent nurses in less than 20 days on average. So we're not a recruiting agency. We don't employ recruiters. We basically, using our algorithms, match the 800,000 nurses on our platform to openings at hospitals that are partners with us. and it allows these hospitals to hire nurses much, much, much more quickly than they otherwise would be able to. So that's what we do, and that's a little bit of our background and where we're coming at this from. Okay, so Jean, let's talk through some of these questions here. Some that were submitted, and then some we've talked about a little bit. Can you just tell us maybe a little bit about some of the unique challenges with nursing that you guys face, and then how they might differentiate your facility from others in the country? Like, what are some of the unique challenges you guys face with nurses, with nurse hiring, but also culture, things like that?
I think what sets us apart is from some of the acute care facilities is that we don't have a lot of the same benefits. We're a small company, and I think if you're work for a smaller institution, we're not able to offer the same benefit package they would if we had 500 employees. Sometimes we can't compete with as much as we can as far as their pay that they're looking for. And I think that that's hard too, because everyone is chasing that dollar. But at the same time, what we do offer that sets us aside is our work culture and a positive work environment where staff can have a voice. And I think that that's where we try to make a difference in the things that we can control here at Eminent.
Interesting. So when you say you don't offer the same benefits, what are you talking about insurance? Are you talking about flexibility? Like, what do you mean? Because you're right, there's pros and cons from working with like a smaller institution. What are some of the things that you're saying, hey, we're really good at this, and then these other areas it's harder for us to recruit because of this?
So I think we offer medical, dental, vision, all of those things, 401k. We have a really decent match with our 401k, but some of the incidental things like tuition reimbursement, we're not a 500-bed facility, so we don't have the same career expansion growth that sometimes nurses are looking for. And more people are looking at getting away from the bedside, like we discussed, and we don't have a lot of non-bedside positions for people to grow into. So I think that that's where, and tuition reimbursement is huge. We've had quite a few people who wanted to go back to school and get their master's, and they're looking at, well, what do we offer? So, and that's where it's a little bit of a challenge. We can cover the cost of like going to a conference for your specialty, but a full tuition reimbursement package, that's a little bit more challenging for us being so small.
That makes total sense. Talk about some of the strategies that you've maybe implemented to deal with some of the challenges that you face, right? Like some of this is culture, it might be flexibility, right? And we saw like money was like fifth on the list of things nurses are after. It's really more about some of those other qualitative um, qualitative things. But yeah, what kind of stuff have you put in place to deal with those challenges?
So something that we've done is we do have some flexible scheduling. We have nurses that work 8-hour shifts. We have nurses in the operating room that work 4 10s. I have some nurses that work 12-hour shifts. And we try to be flexible in finding a schedule that works for everybody, but still allows us to operate daily and meet the needs of our physicians and our patients. And I think we have a low nurse to patient ratio on our post-surgical unit. That's something that at a larger institution, you're going to have 5 or 6 patients. We really want our patients to have a great experience. So typically our nurses have about 3 patients apiece. And that's really kind of what we want to focus on good education for our patients, you having time to spend with those patients and doing a lot of teaching, because our patients require a lot of teaching in general. People just are not as always educated about their disease processes, what their plan is for healing. They can reiterate that. They can work very closely with our physical therapists, for example, to help our patients have the best outcomes possible.
That's great.
And part of that is just having supportive leaders, and that's my goal as the chief nursing officer here, is I really want to get to know my staff. I want them to feel supported and feel like they have a voice.
I love that. I love that. So one of the things I know you've talked about as well in terms of facility or in terms of culture at your facility is like, gamification, a good environment that tries to avoid, burnout. You try to make it a fun place. And I know everybody tries those things, but it does seem like you guys have been very successful with implementing those things. How do you track success with those activities? Like, do you look at retention numbers? And then also, what are the things you're doing to try to build that culture?
So really, we do look at retention numbers. We get a report monthly, and it looks at all internal, not just, I mean, we do separate nursing, but we also look at hospital overall in all of our job roles at retention for all of our employees, because even as much as nursing is a primary role of mine, we still have other clinical and non-clinical positions that are vital to our success here. So we've looked at ways. We have an app called Cool Leaf. It's a way of, one, recognizing each other. Employees can recognize each other, leaders we can go in and recognize, and it's like a point system. So the more you're recognized, the more points you add up. We also use this platform to join challenges. Our most recent one is later this month, we're doing a St. Jude walk. So really, we're giving back to our community, and raising funds for a good cause, but at the same time, it's something that we're all able to do together. Frequently throughout the year, we're looking at different ways. We do food drives. We make it a peanut butter drive challenge for our local food pantry, and we make it a competition, so to speak. Last year we had 5 teams and we did penny wars. So you got so many points for bringing so many jars of peanut butter, but then also donating pennies were positive in one team. If you donated quarters to your opponent, you could decrease their points. So you can see where it's kind of a fun thing to do. And every day people would come in with either jars of peanut butter or bags of coins to kind of sabotage their partners' teams, all in good fun. I mean, for holidays, we do pumpkin carving contests. We have a Christmas party that we just started last year. We make TikToks. We try to have some fun. We did a tortilla slap challenge when that was going around on TikTok. And really, you just try to engage your staff, because we couldn't do any of it without them. And the staff getting excited about being here and about what we do for our patients, and really getting them engaged and active participants, you do seem to have a more positive attitude and a positive vibe throughout the entire building. And our patients can feel that. And I think that what we've noticed is in our patient satisfaction stories, as we've increased these activities and our staff seem more involved and happy, our patient satisfaction scores go up.
That's interesting. So even something as silly, and I don't mean to say silly, but like TikTok usage or gamification or parties increase your staff engagement and excitement, but also directly improve patient experience. That's really interesting. And do you see like actual patient experience scores go up? Is that anecdotal? Like, how do you track that?
So all of our patients get surveyed, whether they're outpatient or inpatient, and we get these surveys returned to us. And so when we look at month over month, we typically do have a tendency to have higher patient satisfaction scores, but now we're getting more consistent with nurses being met and staff members being mentioned by name. Our Google reviews are going up. We're looking at multiple ways that we're getting feedback from our patients, which is our customers, as well as our physicians, because I think our physicians are our partners, but they're also, it's very important, they get feedback on our facility as well, and we want them to, their patients to have great experiences. So the physicians want to bring their patients to us.
I love that. I think that's awesome. You mentioned TikTok a little bit and social media. Are you using that to engage with your staff, the community? Like, how are you using it specifically, social media and TikTok and other tools?
Honestly, TikTok and social media is here. You hear about hospitals, police forces, everyone. It does engage with the community, but it also engages with our staff. I think it's interesting, we just filled 2 nursing positions that had been open for a little while. I want to say one has been open for more than 90 days. And honestly, she saw a TikTok with one of our physicians, and she's like, yeah, you guys celebrated a birthday party, and talking to a staff member who just got hired here like a month prior made them want to apply. So I think word of mouth in your community, because in as large as a facility or as large as the Metroplex is here, the fact that staff members hear about your facility and get your name out there, it really makes them take a deeper look. So TikTok and Instagram, we have both. We have a Facebook page. it's a way that you can integrate all of it with staff, your community, your physicians. More physicians are actually doing educational TikToks, and some of our surgeons are actually recruiting patients that way. Social media is a very powerful tool, and I think the more people, you have to do it safely, obviously. We're not sharing patient data. We don't force our staff to participate. Some of our staff have created their own TikToks, which is fun, like during hospital week. And we just received our accreditation for hip, knee, and spine surgery. So really advertising that, we were able to, make a TikTok, make it fun. Our staff shared it on their own private social media. They worked hard, so we all should be able to celebrate that and celebrate the hard work that they do.
How do you balance, some of the generational differences or gaps that you might have in like a nurse workforce, or maybe between leaders and nurses as well? Like we've talked to other CNOs who say, one of the biggest challenges they have is nurses that are, maybe more experienced and older, and then nurses that are brand new to the workforce coming in and wanting very different things. Like good culture means very different things to those two groups. How do you bridge that? How do you balance that? What is your approach to that?
Something that I do different is I round on every single department every single day. And I really get to know my staff. Like I can tell you their pets' names. I can tell you which ones are married, going through a divorce, had a loved one pass away. Really try to support them and get to know them. And I always ask, what do they need from me as a leader? And I think the biggest thing is being open to that feedback. One of the challenges is the different generations in the workforce. My nurse who's been a nurse for 30 years doesn't need the same kind of support from me as a nurse who's maybe only been a nurse for 2 years. They have very different expectations. And as a leader, that is one of the challenges that we face, is how do you support all of them? And how do you change your approach with my nurse who doesn't need those things? And I admire the fact that they've been at the bedside caring for patients for 30 plus years. And I love the way that they care for their patients, as opposed to the nurse who is uncomfortable still doing all of the skills or assisting with blocks or and still learning. And it's how we can foster and build the bridges of getting them to all work together. And I think recognizing the differences and really highlighting their strengths has helped me. I think the biggest thing is you have to lead differently based on who I'm dealing with. My nurse of 30 years doesn't need me to come in every day and say, how can I help you? Whereas my newer nurse who's still learning, I can be more task oriented with her and saying, okay, what do you need from me right now to make your day go smoother? I've tried twice on that IV and no one's available. I said, okay, I will go start that IV for you. So it's just one of those things of being flexible and being available to your staff, which I know is the challenge, as my schedule fills up regularly. And then you have the fires that come up every day that you're constantly running around trying to put out.
That makes total sense. Let's shift gears a little bit and talk retention. We talked a little bit about some of the tactics you employ, but I know that you go out of your way to know every employee. You try to make yourself available to them. Like, what are the things you're doing to try to make sure that you retain the people that you want to retain?
I think the biggest thing is trying to see what they need or what makes them unhappy about being here. And you have to be okay with having the uncomfortable discussions of what you can't do. And I think more people are not as always transparent with that and how we can best meet their needs. Some of my employees that unfortunately have had to leave, like I said, we don't have a lot of advancement. I had someone who wanted to be a nurse practitioner. We don't hire nurse practitioners here. So they worked for me up until a certain point, and then when they're graduating, we've helped them as far as, you've been a great nurse at the bedside. I wish you all the best. But I think at the same time, trying to keep the staff that we can, like, what about this other role? Is it a better schedule? Is there something we can do about your schedule? We can adjust your schedule. Now, obviously, I can't pay everyone, but whatever they are asking for, and there are some hospitals that are able to throw on a sign-on bonus or a retention bonus and do all of those things. Unfortunately, being smaller, we don't have the same kind of dollar expenditure. to spread on the labor cost of things, side of things. So we try to stay marketable. We do look at that every single year. We use our tools and our analysis to try to see what other hospitals in our area are paying, but also realizing like we do have a lesser patient load. You typically have a good work-life balance. You have to focus on other things besides the dollar.
I love that. I love that. Talk to me maybe a little bit about the flexible scheduling. And I should frame this by saying we did a survey in Q1 of 700,000 nurses, and we found that flexible scheduling, for example, was really important. And then we asked hospital executives, what was important to nurses. They also said flexible scheduling, which is good. That means there's alignment. But then when we asked, okay, do you then offer flexible scheduling? And we provided that without like a definition, like what did flexible scheduling mean? There were actually very few, I think it was less than 20% that said, yeah, we offer flexible scheduling. How do you handle flexible scheduling? How do you define it? Because it means so many different things at every place. But what do you define flexible scheduling as, and how do you provide that option to your staff?
So we look at every unit differently, and every unit has different needs. Same thing with our staff. I have great nurses that can work in multiple areas. However, pre-op is a better choice for them because they have small kids at home, for example. So they can only do 8 hours a day, and so we have to be flexible with our start times. We're flexible as far as like making sure we have enough staff to operate as many days a week as we can, 5 days a week.
Yeah, you have to be covered above all, right? You have to be covered.
Right, because it has to be covered. But I mean, having a mixture, I'm not going to say it's always an easy when someone goes on vacation or something, when you have a mix of 8 and 10 hour folks, because you do have to have overlap every day. On our OR, we do have a couple people with set schedules, so that helps. But you can always plan ahead. But when they're out, and I think that's always makes it a challenge, being so small. I think flexible scheduling as far as inpatient units, everyone typically works 12-hour shifts. However, on our busier days, sometimes nurses, they want to break that up a bit. So we're okay with you coming in and only working 11 to 7 because we're expecting more surgeries at that time. And we'll see if anybody else wants to cover the first 4 hours. And my supervisors and managers here, they do a great job of trying to meet everyone's needs, but at the same time, how to keep us operational.
That's great. Yeah, I think it's that's the part that is often overlooked is you have to stay staffed, right? That's the key. You can be flexible, but you still have to remain staffed. I love that. So what opportunities would you say for like professional advancement are available at Eminent Medical Center? And you mentioned it's kind of tough because in super large hospitals and facilities and systems, there's like all these options, but it probably is much more challenging at a smaller facility. How do you manage that? Like when people say, I want more professional advancement or faster advancement?
One of the things that we've done for staff members who want to be trained in different areas, we started training our pre-op and PACU staff to help cover each other. Some of our pre-op staff, they wanted to learn how to do PAT. Well, it worked out great because our PAT nurse just wanted to take a vacation. We do have staff that are interested in possibly learning operating room. So we start them, with their basics. And this is, again, when you can kind of invest in some of their techniques and their needs and how do you help grow is we tell them about educational offerings. We do offer as far as making sure we have surgical safety and all of this education that we can offer, but also cross-training. Having a very flexible workforce helps us in times when we're busy. It helps the nurses learn and feel like they're growing, and really how they can grow as a facility. As we continue to grow, we hope to expand our facility in ways, and that would create potential need for a charge nurse or a supervisor. And that's one of those things, is really seeing and growing and seeing what you can do to help promote that in the workforce that you have. and let the nurses know that you value that they want to learn these other areas.
I love that. I think that's great. And then how do you track job satisfaction among your staff? Like, do you do surveys? Is it more qualitative? Do you do, is it like quarterly meeting? Like, how do you track that?
Typically, especially in a small place, we've done surveys. I do check-ins, like, hey, how are things going? How do you feel? I have really transparent nurses. I've had I guess as I've moved around in the Metroplex, I've had nurses that work for me at other facilities that have followed me, and then they have a tendency to be very open with me and say, hey, this could be better. Hey, we've noticed this lately. So if it's a scheduling issue, I'll work with scheduling. If it's a physician issue, I'll work with that physician. I think you have to be open to hearing the feedback because staff are willing to give it.
Right. Yeah, what's interesting too is like when you have that constant flow of communication, it becomes less it becomes easier to share that feedback, right? In both directions, which I think is critically important. Anything else you'd want to add about like retention or staff engagement, like anything at all, best practices that you think would be helpful to the other CNOs on the call?
I just honestly feel like getting to know your employees, getting to know their interests, getting to know what they think would be beneficial to add to our services. And I think one of the biggest questions when I'm meeting with staff individually, I ask them what I can do different to better support them, if they have any ideas for the facilities to improve. And you'd be amazed, sometimes it's so little. Sometimes it's things that, it's really frustrating. We got these new IVs and I've noticed this X, Y, and Z isn't working anymore. Can we look at a different product? Our razors are cutting our patients. Can we talk about technique? Maybe we need a little retraining. Maybe it's the blade. Maybe we need a better razor. So I think it's just giving them the opportunity to speak up and improving the workforce and, making it comfortable so they don't feel like it's an awkward conversation. If bad things arise, being transparent, being open. I tell them what I can't do, but I'm telling them what I'm willing to do. And not being afraid to try something just because somebody's never done it before. It could be very beneficial to try.
That's great. Yeah, great point. Just the ability to experiment and learn, I think, is really important. Any final thoughts here? Like, there's some questions coming in. I want to address those, but anything else that's on your mind before we jump into the questions?
I don't think so.
Okay. So we've got a couple of interesting ones. How do you address staff who are disrespectful to other staff and or patients? And then the other sort of inverse of that is how do you handle it when patients are disrespectful to staff?
Okay, so I'll just first.
Those are like we'll go right to the intense questions.
Right. I think the hard part is, first of all, addressing a staff who are continuously disrespectful to staff, or one, being disrespectful to other staff members or patients. You have to address this right away. I always say negative attitudes and negativity grows like a cancer. And you can see when you have an employee who may be bringing down your culture or your mojo in a busy department. You can tell based on who's working sometimes just by them being so negative. And unfortunately, this is where as leaders, you always have to be either managing your staff up or managing them out, because you can't be afraid to cut the negativity out. As hard as it is, you have to address that behavior, because if not, it's just going to continually affect everyone.
Managing up or managing out? That's great. I love that.
Yeah. As far as disrespectful patients, I really value some of our surgeons. One thing that makes us different is I've seen our surgeons here really work with their patients, and we did have a patient who was very disrespectful to the staff, and our surgeon went in the room and was like, listen, you can't talk to people this way. We're here to help you. But if you're going to continue to talk to the staff, maybe this isn't the right place for you. And I think hearing it from the doctor to support the nurses as well as us as leaders and what we can do, if the staff members have done something wrong, sometimes personalities just don't mesh. I mean, you always have those patients who can take things the wrong way.
Sure.
We have a cultural workforce. Sometimes people just don't mesh well. It's okay to say, hey, maybe this isn't the right patient match for you. Let's switch your nurses. In a small facility, it's kind of challenging sometimes because we don't have a lot of nurses to choose from. But at the same time, it's addressing the behavior, letting the patient know, like, okay, this is what we can do, this is what we cannot do. And you have to balance. It's a delicate dance, but I think with the right support, patients will understand. And I think understanding that and getting your surgeons to understand why it's important, or your doctors to understand why it's important to address those behaviors, because you don't want anyone to feel neglected or bad.
Yeah, it's a great point. And then one more question. When you have conflicts between staff, how do you handle that? Like whether it's because of the generational divide or just two personalities that aren't meshing, like, I mean, that happens in any workplace, right? How do you
Yeah.
handle that? What is your approach to that? And any suggestions on that?
I think one thing that has always worked well is, one, you have to listen to each side of the story. Don't make a knee-jerk reaction and make a decision when you only heard one side. Because sometimes for interactions, there's always three sides. You have his side, her side, and then the truth typically is somewhere in the middle, because what you're really dealing with a lot of times is perception and how to change that. One, I always try to get the staff members to talk it out with me there to mediate, or another leader there to mediate. And this is something I coach my managers to do as well, is you have to be able to address it, but not if they're not in the right headspace. When sometimes staff members are very angry at each other, that is not the time to sit down and try to have a discussion on how to improve the working relationship. But at the same time, you have to be able to let them feel heard and let them get their side of the story out without you trying to change that perception, just being open and taking it all in. And I think that sometimes we want to be fixers, so that's hard for us because we'll have a tendency to try to fix things and we won't fully listen to what they're saying. And I think when you take everything in on both sides and then you address it together in a room together and let each of them feel heard and how we can come together and work better together, I've had really good success that way.
Love that. I think that's great. Awesome. Well, thank you for doing this. Really, really appreciate it. We're going to just maybe go through our last couple slides here about Incredible Health and still see if any other questions come in, and then we'll conclude. So just to reiterate, you can read what's been on the screen there for 20 minutes, so I won't. 700 plus health systems, hospitals use us to help them hire permanent nurses in under 20 days. Essentially what we do is employers apply to candidates instead of the other way around. So you're going to get better candidates that are engaged, that are ready to move quickly. And as I said, we have about 800,000 nurses on the platform. It's now over 25% of all the nurses in the US are on the platform. And they join for a variety of reasons, right? Free tools, free content, free social network for nurses. And then most candidates are accepting their first offer, which is really interesting, even when their subsequent offers have higher compensation. So they're accepting that first one. So speed is like the single most important factor if you're looking to get good candidates in the door. And then, with that speed comes a huge cost savings, right? 50% plus less cost per hire if you use Incredible Health compared to any other methodology, simply because the time to source and these other time-bound rows here are just far less intensive. And then people always ask, well, gosh, if you hired them that quickly, surely they leave quicker. Usually not. 15% higher nurse retention at 1 year. And we're actually pulling more data on that now for future years, but it appears to be higher as well. And then the last thing I'll just mention here is if you want to get in touch, you can email us at questions@incrediblehealth.com. We'd love to speak with you. And that's really important for us to talk with as many of you as want to talk with us. Jean, any final thoughts, questions, things that are on your mind that you think would be helpful for other CNOs to know?
No, I don't think so. I think a couple of things, like just being open to feedback, being transparent, as well as just trying to create a positive work culture and getting to know your team.
Love that. I think getting to know the team is like, if I were to summarize everything you've said, it's like building a good culture and getting to know that team are the single most important things you can do. So, Jean, we really appreciate it. This was super fun. You're awesome. And everybody who works with you is lucky to work with you. So we're thrilled that you joined us, and thank you so much.
Thank you.
Hey, thanks everybody. Have a fantastic day and a great rest of the week.
You too.